Today we're going to be doing a Cushings suture pattern for a left-handed surgeon. When starting this pattern, you're going to backhand with your needle first. And you can see that this surgeon is choosing to go at about 45 degrees from the incision, which is totally fine. Some other people will do it parallel to the incision. My preference is to do it this way because I think that it actually buries your knot a little bit better. And you can see here, this is a four-handed bite, is going to be again about 45 degrees from the incision. Either way is appropriate though. Notice that she's not going through the incision edge and coming out adjacent to it. What that does is that helps to invert the tissues, which is the purpose of this pattern. Here you're going to pull your suture ends parallel to your incision, and you can see how nicely that buried. Sometimes that won't bury quite as nicely, and it's not a big deal. I'll show you a trick here in just a second in order to get that a little bit buried just a little bit better. Here we're going to kind of fix our knot here, make sure we're tying a nice square knot, and then move forward. On this model, you're going to end up using full thickness bites. However, the Cushings pattern is a partial thickness suture pattern. The reason is that these models are just so thin that it's difficult to get partial thickness bites and not have the suture pull through. So just remember that when you're doing your pattern on a live patient, if you're planning on doing a Cushings pattern, that's going to be partial thickness bites, not full thickness bites. Now that we've got our knot tied, you can see that she's taking a bite behind the knot, and that helps to bury it further. So again, if your knot didn't bury quite as much as you would have liked it to, not a big deal. You take your next few bites, this bite and then the one across from it, behind your knot, and what that does is it infolds the tissue just a little bit more. You can see that all of the bites now are going to be parallel to the incision, not going through the incision, but just adjacent to it. When you're taking those bites, it's important to remember that the length of your bite is going to be dependent on the size of your patient. So obviously bigger patients, horse patients with more tissue are going to have bigger bites than you would do in a dog or a cat. And for the purposes of practice, go approximately the length of your needle, like the surgeon is demonstrating here. When you pull that tight, you can see how the entire pattern kind of infolds there and the suture is not visible. And that's the goal of this pattern, is to infold the tissue and to prevent leakage. Continue going parallel to the incision all the way to the end of the incision here. See, pulled nice and tight. It's a leak-free pattern. Now, to end your pattern, we're going again at about a 45-degree angle. Again, there's nothing wrong with going parallel to your incision for these bites as well. However, I really do think that in practice, you'll see that your knot buries better when you don't. Now, this should be a backhanded suture here, and you can see in a second the surgeon realizes that error and fixes it. So forehand for the first bite, backhand for the second bite, so that your suture end ends up toward the middle of your incision here. One way to think about it is basically using these as superficial and deep bites, as though you were when you're closing a subcutaneous pattern. But if that messes with you, then don't worry about trying to think of it that way. For some people that's easy, some people it's not. And then you're going to tie to the loop here, again pulling parallel to the incision in order to help that knot bury. Your second knot will never bury as well as your first knot did, so no big deal on that. Just tie it and move forward. We're trying to bury it the best that we can, but it's never going to be as nice as your first knot. And then the surgeon's going to go ahead and